To Dr. Mensch, the radio show that takes a real, compassionate look at mental health from A to Z. Join child and adolescent psychiatrist Dr. Gil Lichtshein each week as we explore topics that matter: autism, ADHD, anxiety, depression, OCD, schizophrenia, behavioral challenges, neurodevelopmental disorders, and more. No stigma, no judgment. Just honest conversations, new therapies, breakthrough treatments, and real solutions for real people. Mental health is not a weakness. It's a treatable medical condition, and help is available. Join the conversation now by calling the studio at 888-994-4995, Studio A. This is Dr. Mensch, where hope and healing begin.
Dr. Gil Lichtshein, aka Dr. Mensch. I'm a board-certified child, adolescent, adult psychiatrist. My practice is in Boca Raton at 7100 West Camino Real, Suite 404, and my phone number is 561-300-4052. In my practice, I treat children, adolescents, and adults with a wide range of mental health issues. I also do ketamine treatments and another treatment called transcranial magnetic stimulation. These are treatments I plan to discuss in future radio shows, and I also teach medical students at FAU College of Medicine. And I also do forensic evaluations. So I try to wear many hats in my practice, and as a result, I work long hours and I'm quite busy. Today, I'd like to talk a little bit about anxiety disorders. It's probably, as a group, the most common psychiatric disorder in children and adults. I kind of lump it into a category called anxiety disorders, but in reality, there's a bunch of kind of different types of anxiety disorders. Social anxiety disorder, phobias, panic disorder, and generalized anxiety disorder. And then in children, they have other disorders such as separation anxiety disorder and selective mutism. But the key features of all these disorders is pathological anxiety. And I try to explain to people that anxiety is a normal human emotion. I mean, it's normal to get anxious if you have a big exam, a big meeting, you're going out on a blind date. You worry a little bit about this or that, but generally speaking, you're able to kind of manage it, overcome it, and do what you have to do without any problems. But when anxiety becomes problematic, it starts overtaking your life, affecting your ability to function, affect your ability to conduct your business. It can even affect your physical health. And when that happens, that's when you have an anxiety disorder. So again, by definition, an anxiety disorder is when it starts interfering with aspects of your day-to-day life and day-to-day functioning. Just today, for example, I had a 40-year-old man coming to my office who I've been seeing now for a few months. He came with his wife. His wife's a very successful Israeli fashion designer. I have a loving family, but this gentleman, you would never know, but when you talk to him, suffers from terrible anxiety. And he just worries about everything and anything. He even was telling me today how he's afraid to go to sleep because he's worried that his heart might stop and therefore he'll die and he won't wake up. But that's how terrifying, and even his wife was saying that, in the past when they would drive in a car, he would sometimes get so anxious he would actually get out of the car and like walk home, even if it was like miles. That's, kind of the definition of someone having an anxiety disorder. And for him, it's been completely crippling, debilitating, and really like impacting his life, but not only his life, but also affecting, the life of his family, where his wife at times has like rescheduled business trips back to Israel because she's worried that if she would leave her husband alone with the kids, that she's worried that he wouldn't be able to take care of the kids because he might have, a severe episode of anxiety would just affect his ability to even not only care for himself but care for his children. So, anxiety disorders as a whole is a pretty disabling condition. Actually, some people who have panic disorder, which is characterized by having these recurrent panic attacks, which are these like sudden, intense, overwhelming episodes of crippling and overwhelming anxiety, that sometimes it can get so severe that patients commit suicide. And suicide is an unfortunate reality in patients with especially panic disorder. People with anxiety often will go to the emergency room. They might think they're having a heart attack when in fact they're having an anxiety or panic attack. And the other thing too about anxiety disorders is that I find it to be a great mimicker that often people with anxiety disorders will manifest it through a lot of physical symptoms. And I have my own GI issues, but when I've gone to see my GI doctor, he's always told me about how many psychiatric patients he treats, and that he's well versed with the different psychotropic medicines like the SSRIs and other antidepressants, because there's such a mind-gut connection, and that actually stems from neurodevelopment, that when the fetus is developing in their mother's uterus, that the brain and the gut kind of come from like the same ancestor, or they have that kind of similar ancestor, and they kind of like bifurcate. And the reality is that the greatest amount of receptors of serotonin in the body are not in the brain but in the GI tract. And so that kind of shows or proves that there's this kind of close relationship between the brain and the gut. And often common symptoms of anxiety include like diarrhea, stomach pain, irritable bowel syndrome, constipation, nausea, and that any patient that comes into my office complaining of all these symptoms, instead of saying, oh, you need to get a colonoscopy or an upper endoscopy or go to your GI doctor, that you need to rule out anxiety as a potential etiology to explain their physical symptoms. But what I tell patients when I assess them and tell them that they have some type of anxiety disorder, I tell them that anxiety disorders, while they're common and tend to be chronic and recurrent, they're very treatable. And I even tell that to when I lecture at different conferences and talk about especially anxiety disorders in children and adolescents, and discuss how it's the most commonly diagnosed psychiatric disorder in children, as a group, anxiety. I always say to parents, if there's any mental health issue that you want your child to be diagnosed with, I say it's either ADHD or some type of anxiety disorder. And the reason being is that both diagnoses are very amenable to treatment. Anxiety responds well to treatment. And so even though the treatment isn't curative and you're not cured of your anxiety disorder, you could live a very productive and healthy life in spite of, say, having generalized anxiety disorder or panic disorder or social anxiety disorder. And the key thing is recognizing this from the get-go, getting into a mental health professional, getting evaluated and getting assessed, and following through and complying with treatment recommendations. And my forte, is using, pharmacotherapy or using psychotropic medications, but I'm also a big believer in therapy, and in those with, I would say, more milder forms of anxiety where it's affecting their functioning, but they're not, let's say, completely crippled or debilitated, I would usually recommend patients to go with the route of therapy, and specifically something called cognitive behavioral therapy, which is a type of therapy that really focuses on your thinking process, because really anxiety is very cognitive. I always tell patients how you think affects how you feel, it affects how you act and how you behave and how you react. So if you like for example, a person with anxiety tends to kind of think the worst case scenario. They're the glass half empty thinker. They always catastrophize things, or they make mountains out of molehills. And so if you're able to kind of change how you view something, or if you start thinking that the glass is half full and not half empty, that's going to affect how you feel, how you act, how you behave, and how you just react to things. Again, people with anxiety tend to be more negative thinkers. If you change that, like someone with anxiety might say, I'm going to fail this exam, or I'm going to ask this girl out on a date and she's going to reject me, or I won't get hired at this job, or I'm going to screw up my lecture. But again, if you start challenging those thoughts, questioning those thoughts, asking the person, what evidence do you have, for your thinking, and having them try to look at it from a different perspective, it could really have an impact on how they then approach similar situations in the future. And what I tell patients about cognitive behavioral therapy is that it's very time limited. We're talking about 3, 4, maybe 5 months. It's not something you'd be doing for years. And that the skills you learn now could be utilized in the future. So that whatever techniques, skills you have refined with your trained therapist, you could apply, for the rest of your life. And so there's a lot of benefits, to cognitive behavioral therapy. It requires active participation of the patient. They have to be motivated. There's going to be homework they're going to have to do, and they're going to be willing, want to come to treatment and willing to change. So it does require some type of commitment. It's kind of signing a contract, and the individual or the patient wants to be willing to do it as opposed to being forced to do it. But the benefits of cognitive behavioral therapy really far outweigh any negatives, and this is a proven therapy that's been around for decades, and there's dozens and dozens of of studies, both in adults and children, that prove that it is kind of effective, like if we're using legal terms, beyond a reasonable doubt. And so usually I will propose that as the first line of treatment, certainly in kids and in adults with more moderate levels of anxiety. And the only caveat is that you want to find a practitioner who's trained in this and has some knowledge and expertise in this area. And so the only downside is if, let's say, you're living in a more like rural area, it might be more challenging to find a therapist that's trained in cognitive behavioral therapy. But nowadays we have Zoom, and so cognitive behavioral therapy can even be done via telehealth and is still as effective as if it's done face-to-face in the office. Now, if let's say there are situations where cognitive behavioral therapy is just not enough, or the patient remains symptomatic, or presents to a mental health professional with such crippling and disabling symptoms, that's where medication might come into play. And the way I kind of give an analogy of medication is that if someone is like way out in outer space, you could talk to them till you're blue in the face. It's just going to go into one ear and out the other. So medication is kind of almost like a fishing rod. It kind of reels you in, kind of takes the edge off. So now you're in a less anxious, less heightened state, and so that you are in a better place to be able to take in whatever information and techniques are trying to be taught to you in therapy. And again, just like with cognitive behavioral therapy, the use of medications, primarily what we would consider antidepressants, such as the serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, have been proven to be very effective. And there's many of them that are FDA approved. I think they're all equally good. It's just a matter of a clinician having his or her own preference with one. There are even there's 2 of them even approved in children and adolescents, and even data shows that these medications, even the ones that are not FDA approved in children and adolescents, are very effective. So the good thing is that there are a number of pharmacological options out there to use, and for the most part, they're all equally effective. Now, the other interesting thing is when it comes to children, the same medications are used to treat depression as they are in treating anxiety. But yet when it comes to children, when we do what's called randomized controlled trials or placebo-controlled trials, get a sample of subjects or patients, and we randomize them. And so, and when they say double blind, meaning the group doesn't know whether they're taking the active drug or a placebo or a sham pill. And if a study of a drug has a high placebo rate, it's really an ineffective study. You want to have a separation between the active drug and placebo. So if there's less separation between the two, it really is a failed trial or a negative trial. And what's interesting in children, I don't really have an explanation for this, that studies with SSRIs in children with major depression, that except for fluoxetine or Prozac, there has been very little separation between placebo and the active drug. We're going to actually continue this after a brief commercial break, so when we get back, we'll talk more about pharmacotherapy. Thank you.
What happens when the mind of a healer crosses over into the darkness of the human soul? From authors David Lacavetti, Dr. Gil Lichtshein, and Yolanda De Luca comes a chilling psychological thriller, Dr. Mensch, A Prescription for Evil. This gripping novel follows a respected Boca Raton psychiatrist who secretly descends into madness, transforming into a modern-day king of the underworld. Inspired by true events and Dr. Gil's childhood connection to a mob family, this story blurs the line between sanity and evil, genius and destruction. Unforgettable, disturbing, impossible to put down. Get your copy today on Amazon.com. Dr. Mensch, A Prescription for Evil, a 2020 psychological crime thriller.
You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshein. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show. You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshein. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show.
Welcome back. This is Dr. Gil Lichtshein, aka Dr. Mensch, board certified child, adolescent, and adult psychiatrist in Boca Raton. I wanted to continue talking about pharmacological treatment of anxiety disorders, and before the commercial I was talking about the use of SSRIs or serotonin reuptake inhibitors in children and adolescents, and was mentioning how that in studies with major depressive disorder there was very little separation between active drug and placebo except for Prozac, but that in anxiety disorders the same drugs used had a much more distinct separation, that these drugs had a very high response and remission rates and much lower placebo rates, and don't really have an understanding or an explanation as to why. But what it shows is that A, these drugs are very effective, and B, that children are very responsive to pharmacotherapy. The other thing we've found with anti-anxiety, the use of SSRIs in children to treat anxiety disorders, and really it's true as well of the adults, is we're going to see the results a lot sooner and quicker than in depression. I usually tell patients that when I use SSRIs to treat depressive disorders that you really got to give it a good 4 weeks to get the full impact or really get a good assessment if the treatment is working. With anxiety, you might see results as quickly as 2 weeks. So that's another good thing about, again, when I tell patients, hey, if you want to have or be afflicted by any type of mental health issue, anxiety disorders are probably the best ones to be afflicted with because, again, of their high responsiveness to treatment. Now, there are situations when patients don't always fit neatly into that treatment box and respond accordingly to the first choice you try. And there are, exceptions to the rule where you have patients who are more treatment resistant. So there are kind of novel options and novel combinations of medications that can be used. I'm not going to get into all the detail, but there are a combination of antidepressants, using antipsychotics, getting into the treatment I briefly discussed at the outset, transcranial magnetic stimulation. I mean, that's really more for treatment refractory or treatment resistant cases, but for the most part, I would say majority of patients with, again, clear-cut anxiety disorders without any other comorbid, psychiatric disorders, that SSRIs, serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors are very effective and often as a sole choice can do the job. Now, part of the kind of negatives about these clinical trials is that these patients, there's a lot of exclusionary diagnosis, so a lot of these patients can have one thing or another. Patients that come to my office often will have a mishmash of mental health issues going on at the same time. And with that, often a lot of anxiety disorders kind of morph or mishmash with each other. So I might have patients that have a combination of, say, social anxiety disorder and generalized anxiety disorder. And again, someone with generalized anxiety disorder, I would call that person the worrier or the worrywart, one who worries about everything and anything. Or some people with panic disorder might have phobias or might have generalized anxiety disorder. And then when you deal with kids, there's kind of like this developmental trajectory where, depending on the age, you might expect certain anxiety disorders more prevalent than others. For example, panic disorder is not typically seen in young children or even young teenagers. You'll see them more in like 14, 15, maybe 16, 17-year-olds. That's something as you get older. Younger kids, you might see phobias and separation anxiety disorder. School-age children, social phobia and generalized anxiety disorder. In adults, there's not that much of this kind of developmental evolution or trajectory. And a lot of times, at least patients who come to my office, I'll probably see kind of an overlay of anxiety disorders. And again, that probably plays a role or is due to the kind of same circuitry in the brain that's affected. And nonetheless, even though someone might have a combination of anxiety disorders, it doesn't change the treatment. So cognitive behavioral therapy, pharmacotherapy, combination of pharmacotherapy and cognitive behavioral therapy will all work for all these myriad of different anxiety disorders. Now again, some of the more specific techniques in cognitive behavioral therapy, and that's a little bit beyond my scope of expertise, might apply differently to the type of anxiety disorder. So for example, someone had a specific phobia of elevators, a therapist might treat a patient by throwing him in the elevator and having him go up and down the elevator and have basically a panic attack and desensitize them, as they experience a panic attack and realize that they're not going to die or be in any danger. Someone with, let's say, social anxiety disorder, you might not do that. Maybe you throw them into a large crowd, but someone with social anxiety disorder, you might have them imagine being in a large crowd and working through their anxiety. So sometimes the, specific techniques utilized might be different, but overall, cognitive behavioral therapy is cognitive behavioral therapy, and again, is really equally effective or very effective in the whole range of anxiety disorders. And the same thing with medication. Whether someone has social phobia or social anxiety, specific phobias, generalized anxiety disorder, or panic disorder, the medication approach really isn't any different. And I would basically, tailor, the pharmacological treatment based on either patient's past experience with medications, my own favorite option to use, or maybe family response to a particular medication. But again, regardless of what anxiety disorder they have, the overall treatments are more or less very similar and the same, and the prognosis, again, are pretty good. But the key thing that I would say is the earlier you get into treatment, the better. The longer you wait, the prognosis gets poorer, and that's no different than, let's say, God forbid, you had cancer, and the longer you wait, the less likely you're going to recover. The earlier you attack the cancer, you might have a better prognosis. Same thing with diabetes or any other health issues. So the same applies with mental health. If you see in a family member, a loved one, or yourself early signs of anxiety that's becoming problematic and affecting your day-to-day life, go seek treatment. If you don't know who to go to, call your primary care doctor. They might make the referrals, but get the treatment, because the earlier you get treated, the better the prognosis. And again, if you need to reach me, I can be reached in my office at 561-300-4052. And hopefully that I provided you with some educational information about probably very commonly diagnosed psychiatric disorders and as anxiety disorders. Thank you for listening to my show, and I hope you have a wonderful holiday season.
Joining us for Dr. Mensch with Dr. Gil Lichtshein, helping you navigate the world of mental health with clarity and care. If you or someone you love needs support, you're not alone. Treatment works and recovery is possible. To schedule a consultation or discuss non-medication therapies, personalized treatment plans, or psychiatric care, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. You can catch us each week on South Florida Oldies Radio and streaming across all social platforms. Until next time.